Hi there. Welcome to another installment of my Ultrasound Diaries. On this day, a 35-year-old man presented with a history of acute swelling of the penile shaft following rigorous manipulation of an erect penis. There was associated severe discomfort, which made ambulation very difficult.
So, what were my ultrasound findings?
From the anatomical illustration on the left, we can identify three erectile bodies of the penis: the paired corpora cavernosa and the unpaired spongiosum. When we compare this with the ultrasound image on the right, we observe an additional heterogeneous collection that appears to have laterally displaced the corpus spongiosum, which appears superiorly placed in this image as a result of the orientation of the penile shaft when the ultrasound was done. On further assessment, this heterogeneous collection demonstrated no internal vascularity on color Doppler interrogation, raising suspicion for a hematoma. The key question then became, what is the source of this collection? As I scanned from the distal tip of the penis towards the proximal shaft, this systematic sweep allowed me assess the full extent of the collection. And as this continued, it became evident that the collection was not isolated. It appeared to be continuous with one of the corpora cavernosa. More specifically, the collection seemed to arise from a defect within the echogenic sleeve, that is, the tunica albuginea, that covered the affected corpus cavernosum, making the collection most likely a communicating hematoma. In this image, the collection and its relationship to the affected corpus cavernosum are further evaluated in the longitudinal plane. Here, the right corpus cavernosum is involved. We can clearly appreciate that the echogenic tunica albuginea is disrupted at the point from which the collection arises. Through this defect, the collection extends outwards, tracking ventrally from the corpus cavernosum. On the next slide, the left image shows the longitudinal and dorsoventral dimensions of the collection to assess its full extent. These measurements help quantify the size of the hematoma and provide important information for surgical planning. On the right, a well-labeled image of the pathology clearly outlines the collection. It also outlines the tunical breach and its relationship to the affected corpus cavernosum, as well as the adjacent corpus spongiosum. This image consolidates the key finding, which is a tunica albuginea defect with an associated hematoma tracking ventrally towards the spongiosum. And here is my report. A hypoechoic breach in the echogenic and linear tunica albuginea can be appreciated within the right corpus cavernosum. An associated heterogeneous collection having an approximate volume of 9.03 mils is seen tracking ventrally through this breach, displacing the corpus spongiosum. The collection demonstrates no internal vascularity on color Doppler interrogation. And my impression? Ultrasound features strongly suggestive of penile fracture. And my suggestion is for urgent urological intervention, as this is a surgical urological emergency requiring immediate diagnosis and intervention at the point of care to improve the outcome. Stay tuned for more ultrasound.